Her name is Megan. She's a 54-year-old female. Her admission diagnosis was heart palpitations, dizziness, and hypertension. She was then moved from the ER to the med-surg unit, and we were continuing to monitor her. She is on a telemonitor. Initial vital signs showed elevated blood pressure, but her other vitals were in normal limits. She is oriented ×4. She's cooperative with no acute distress currently. Vital signs stable. Elevated blood pressure, I would just keep an eye on that.
Okay.
She's had no recent falls, no change in her neurological status. I would just recommend continuing with the telemonitor, monitor her blood pressure, and notify the physician if her blood pressure gets any higher. And also just keep an eye on dizziness.
Okay. Awesome. Thank you.
Yeah.
Hi, Megan. How are you feeling today? You squeeze my hands for me, please? Could you raise your hands for me both up a little bit? Oh, that's not good. Okay, I'm gonna take your blood pressure here. Ooh, 190/110, not looking good. Cold blue.
Kira, what are her symptoms?
She has facial drooping, she has left arm weakness, she's having slurred speech, blood pressure is 190/10, she's having a stroke right now.
Okay, we need a stat CT scan and stroke activation team, and prepare an IV and also for possible TPA administration.
Okay. Can I get another nurse in here? Hi, Avery, can you please go get an IV for me? Can you also call radiology?
Yes, I'll get an IV for you and notify radiology.
Okay, thank you.
Hi Megan, my name is Avery. I'm your speech pathologist today. I'm gonna try giving you a sip of water to see if you can swallow it. We're gonna do a little swallow study quick if that's okay.
Okay.
Okay, I'll be right back. I'm gonna go grab the water quick. Alright, here we go. You ready? Okay. You okay?
Mm-hmm.
Okay. I'll be right back, okay? Hi, are you the nurse with Megan today?
Yes, I am.
I just did a swallow study with her.
Okay, how was that?
Megan is having trouble swallowing. I think we should keep her NPO status until we can reassess.
But she's been asking for a lot of water, and I think she's become pretty frustrated.
I understand that, but I'm really concerned about aspiration pneumonia.
I'm concerned that restricting her too much will make her feel helpless. And I understand the aspiration risk, but I also feel uncomfortable denying her hydration without any alternative. Could we maybe explore some safe swallow study strategies?
Yeah, we can do that. That's a fair point. I'll discuss with Dr. Rodriguez and try maybe thicken liquids.
Okay, thank you. Hey Megan, see that you're a little frustrated. Is there any way I can help you?
Yes. My arm is still weak.
Yeah.
Could you please grab my cup?
Yeah, of course I can help you out here. There you go. Megan, I'm here for you in any way, okay? We're gonna get through this.
Hi, are you the nurse for my mom?
Hi, yes I am.
I'm her daughter.
Okay, nice to meet you.
Will she ever be able to talk normally again?
You know, many stroke patients with time and recovery recover from this stroke, and we're gonna do the best that we can and take it one step at a time to help Megan get there. I'm here for you guys in any way you need.
Thank you.
Thank you all for coming to discuss Megan's care plan. I'm Diana and I'm her physician.
I'm Kira. I'm the nurse that's with Megan today.
I'm Avery. I'm a speech pathologist.
I'm Sarah. I'm Megan's occupational therapist.
Okay, so from the medical standpoint, Megan responded well to TPA and other anticoagulant therapy. This limited the extent of damage that the stroke could have caused. Her impaired motor function is still really significant, so she will need supportive therapies just to try to regain as much like motor function, and then as well as like speech function. Sarah, do you have any medical observations from your standpoint?
Yeah, I've noticed that she's starting to stand with assistance, but she does still have that significant left-sided weakness, as you mentioned, which really has been impacting her ability to perform ADLs.
I saw this earlier with Megan when I walked into the room. She was having difficulty grabbing her cup with that left side, so she was frustrated with that.
Yeah, yeah, she's been learning ways to rely more heavily on her right side, but we've also been working on using functional equipment and practicing things like dressing and eating and normal tasks like that with her left side and how to support that side of her body.
And then as the speech pathologist for Megan, Megan is making progress with communication, but she is still struggling with complex sentences.
Okay, interesting. So I think we should set short-term and long-term goals as a team, and then afterward we can schedule a care conference with Megan and her daughter Avery, and then we can just discuss options and their preferences, just to ensure patient-centered care. Does that sound good to you guys?
Yeah.
That's a good plan.
Sounds great.
Hi, I'm Diana and I'm the chaplain here for the hospital. Just wanted to talk a little bit about your faith.
Okay.
How have you been feeling these past few days?
Well, it's been hard. Nothing like this has happened before.
Yeah. Do you think your faith has increased, or have you gotten more closer to God over these past few days, or are you?
Well, I've had faith my whole life, and this time here has challenged me. I've been so weak that I've really had to rely on those around me and pray even more than I ever have.
That sounds very hard.
Mhm.
Well, I want you to know that recovery is a journey, okay? And we're here to walk alongside you.
Okay, I've just been feeling so much like a burden.
Oh, Megan, you're not a burden. You're so valued, and we are here for you in any way. Okay.
Thank you.
And the hospital also provides a lot of faith-based resources for you. We have like prayer groups that our patients have really benefited from, and also one-on-one counseling. And we also have an open chapel for reflection. Those are welcome for you to use.
Okay. It's been hard being in the hospital so long. Not going to church or doing my normal routines in the community. So that sounds really encouraging to be with other believers right now, or in a calm space like that.
Yeah, of course. And we're here to provide any resources that you need.
Thank you.
Just want to say thank you. Faith is very important to our family.
Yeah, of course.
Hey, Megan. What can I help you with?
I would love to go for a walk.
That sounds like an amazing idea. Okay, well, we got your walker here and gate belt. Let's do it. You want some help putting on these shoes, too?
I got it.
Okay. Hey, you go, girl. Awesome. I'm gonna put this belt around you and then we'll get you going here.
I am so excited.
I'm excited too for you. It's been awesome being able to see your recovery from where you were a couple weeks ago to where you are now. Here we go. Okay, you ready? Let's do this. You're walking so good, Megan.
I have more energy.
Yeah, you look like you have more energy.
Megan, you're doing amazing.
Thank you.
I'm so proud of you. This is what teamwork and faith can achieve.
Thank you for everything.
You're welcome.